Methods of the obstetrical examination. Obstetrical examination is performed to assess the maternal and the fetal well-being during the pregnancy. It includes history taking, general examination, abdominal examination, and the pelvic examination. General examination vitals, blood pressure to detect the preeclampsia, pulse, assess the cardiovascular adaptation, temperature detects the infection, respiratory rate, access the pregnancy-induced respiratory changes, edema. Physiological in the late pregnancy, pathological in the preeclampsia, severe and the generalized. Weight measurement, assess the appropriate weight gain based on the BMI. Breast examination, assess for the tenderness, nipple changes and the lactation readiness. Obstetric abdominal examination, performed after the 20 weeks when the uterus became palpable. Steps of the abdominal examination, 4 steps. Inspection, shape and size of the abdomen, stereo gravidum, stretch marks, linear nigra, hyperpigmented midline and the fetal movements. Palpation, fundal height measurement, measured from the pubic symphysis to the fundus. Fundal height, gestational age in weeks after 20 weeks. Landmarks for the fundal height, 12 weeks out, just above the pubic symphysis. 20 weeks at the umbilicus, 26 weeks at the xiphoid process. Leopold's maneuver. 4 maneuver. First maneuver, fundal grip, identifies the fetal pole in the fundus, locates the fetal bag, identifies the presenting part, phallic grip, pelvic grip determines the fetal engagement. Auscultation. Fetal heart sounds are detected by the Doppler device 10 to 12 weeks, stethoscope, pain and stethoscope 20 weeks. Normal FHR 120 to 160 VPM. Percussion detects the fluid accumulation, polyhydramnios. Obstetric pelvic examination, performed to assess the cervix, pelvis and the fetal descent. Types of pelvic examination. External genital examination, checks for the infection, lesion and the varicosities. Speculum examination, assesses the cervix for the dilation, infection and the bleeding. Digital vaginal examination, cervical effacement, dilation in the labor, station of the fetal in relation to the ischemic spines, pelvic adequacy for the vaginal delivery. Special obstetric examination, non-stress test, evaluates the fetal heart rate response to the fetal woman. Biophysical profile, includes the NST plus ultrasound assessment, fetal role, breathing, movement and the amniotic fluid. Ultrasound examination confirms the fetal viability, position and the placental location. Pelvimetry, assess the pelvic adequacy for the vaginal delivery. Fundal height in the centimeter. Gestational age in weeks after 20 weeks. Leopold's maneuver help determine the fetal life position and the presentation. FHR, normal age 120 to 160 BPM detected by the Doppler at 10 to 12 weeks. Cervical effacement and the dilation are assessed via the vaginal examination. Its adequacy is evaluated during the pelvimetry. Non-stress test assess the fetal well-being. Biophysical profile includes the NST plus ultrasound evaluation. Digital vaginal examination should be avoided in the placenta previa to prevent the hemorrhage.